Hey everyone, I'm Lucy Douglas. I'm owner and CEO here at New Beginnings Wellness Center and Spa in Ruston, Louisiana. You know, I often think of things that I would like to speak to you about based on what I'm seeing in my patients and in my practice daily. And so this is a topic I've been meaning to talk to you about for a while, and I've just gotten lit on fire again about it recently. And I want to talk to you about your stomach, and I want to talk to you about the epidemic of overprescribing of a certain classification of medicine for heartburn and reflux. This classification of medicine, they are called proton pump inhibitors, PPIs, and those are Prilosec, Nexium, and Protonix. These are now available over the counter, which is very disturbing because they have a black box warning on them. And the black box warning says they should not be utilized for longer than 2 weeks. Well, it is not uncommon at all for a patient to come in here and they don't even mention that they're on one. That's not necessarily the reason why they're coming here, because they have a gut issue. But then I see that on their med list and I'm like, how long have you been on this? In years. So common. These are being prescribed and then just refilled, or if your prescription runs out, now that you can get them at Walgreens, you go put yourself on the over-the-counter version of these medicines. And you don't know any better, because guess what? It's our job to know and to tell you that these are temporary and should not be utilized for years and years and years. If you're having heartburn, guess what? It's your body going like this. Hey, I'm unhappy. Fix me. Well, when you take that medicine every day, you're basically telling your body to shut up. It's a Scooby-Doo Band-Aid on a severed artery. So what that medicine is doing and why we love it and why you don't want me to wrestle it out of your cold dead hand is because those medicines turn off the cells that line the stomach that make acid. Literally turns them off. And here's what I say to patients. Did God make a mistake when he put those cells in the lining of our stomach? And they look at me and they're like, is this a trick question? I'm like, no, it's not. And the acid was put there by design. You are supposed to have an acidic environment in the stomach in order to properly digest your food and then to begin the extrapolation of nutrient part of the digestive process. And if you are slapping the parietal cells and telling them not to make acid and turning that completely off, there's several things that happen now as a result of that, of you not having the proper acidic environment inside the stomach. One thing is you're not absorbing nutrients. And there's several key things that you will not absorb. You will not absorb calcium, you will not absorb magnesium, and you will not absorb iron. So for you menstruating women that are losing buckets of blood every month in your period, and you're taking a proton pump inhibitor, you're gonna feel like poop on a platter because you are dropping your stored iron so drastically. It's gonna cause you to feel cold, it's gonna cause you to feel tired, and very frequently your hair is falling out. And all of you think you have a massive thyroid problem, which sometimes you do, but more commonly is you have an iron storage problem. And your traditional providers are not routinely checking that. Actually, they're not checking it at all unless you get up on your hind legs and demand that they check it. Because they think because your hemoglobin and hematocrit are very often still normal, they don't then look into the iron studies and look to see what your iron is doing. But I've seen women who have a normal hemoglobin and hematocrit, even if they are one of those that has an extremely heavy menstrual period and they're not classically anemic, but I see those iron stores very low and they have a lot of symptoms of anemia. So that's an additional test that needs to be asked for if you're not one of my patients. So you can see where the long-term use of a proton pump inhibitor could be very detrimental to you from a nutrient standpoint. So if we're blocking absorption of calcium and magnesium, what is that going to affect? Your bones. It's going to affect your bones. So say you're a menopausal woman who's a smoker. You've never been on hormone replacement therapy, and you're petite and you're white. Perfect storm for osteoporosis. So these are things the average layperson does not know. I would say it's not really your responsibility to know these things. It's my responsibility to know. It's my colleagues' responsibility to know and to inform you of the risks of using these medications long term. I'm not saying there's never a place to use one of these kinds of medicines. And so in the place of a gastric ulcer, that's a whole nother matter. For all of you who have heartburn and indigestion and reflux, that is your body clearly trying to communicate with you and tell you it's upset about something, but you're not listening. And I will tell you, in my experience, I'm easily able to get you off these medications by asking you to change what you're eating and then putting you on a very specific gut repair program, which I will speak to you about in the next video. And it's not something we can fix overnight. You can't stop these medicines cold turkey, because if you do that, you're going to have a resurgence of acid that will make you feel horrible. It'll make you feel like you're like drowning in acid up in your throat. So a lot of people will come and tell me that they've had voice changes, like they're dealing with being hoarse, or maybe they're a singer and they've noticed that there's difficulty there. And they go to their doctor or their ENT and they get that little fiber optic tube drop down the back of the throat, you know, when they get that looked at and they're told, oh, you've got irritation there in the posterior pharynx where your vocal cords are, and you know, all of that, and that they're saying you're having silent reflux. But again, that begs the question, where's it coming from? If we are designed to have acid in our stomach, I don't think we're designed for that acid to back up into the esophagus. As a matter of fact, I know we're not, because there's a sphincter between the esophagus and the stomach called the lower esophageal sphincter. And the job of that sphincter is to maintain the barrier between the stomach and the esophagus, because the esophagus is not designed to tolerate continuous exposure to the acidic stomach contents, but the stomach is designed for that because you have a thick mucosal lining there. And so it's designed for acid to be produced there, with the point of that being to properly digest food and extrapolate nutrients. The other thing that is important is that if we wipe out all the acid in the stomach, then we're going to get a real significant dysbiosis. We're going to get an overgrowth of pathogenic bacteria. You are going to be more susceptible to bacterial invasion, and that's going to set into motion a whole nother set of problems. Persistent bloating, belching, abdominal bloating, perhaps constipation and diarrhea, either or both. So taking those medicines long term is not good for you. The other thing that's being talked about in the medical literature is that, is there a correlation between long-term use of these acid-blocking medicines and dementia? And I don't think that we have a final word on that, but if I'm just talking logically and saying, if I'm blocking my B12, that's another nutrient that's being blocked with long-term PPI use. If I'm blocking calcium, magnesium, if I'm at risk for bone loss and fracture, it would stand to reason that I'm depriving all of my end organ tissues of nutrients, because how else am I getting nutrients if I'm not getting them through my nutrition and perhaps some targeted supplementation? I'm not saying that's the gospel. I'm saying it makes sense to me, and it's something we should talk about because it's out there. It's out there on the internet. There's studies that are being done, and this is common knowledge. And so I'm dismayed that healthcare professionals are not more astute about this and the risks with these medicines. All of these prescription drugs, name one, there are risks. So I'm not just picking on a PPI, but I'm saying it's one that everybody gets put on. It's passed out like sweet tarts, and nobody's talking about, well, gee, Karen, why are you having heartburn all the time? Well, let's talk about where we think that's coming from and fix it. Because I don't want to take a pill every day that's turning off something that was put in me by design for a purpose. It's kind of like my getting hysterical about you rolling up into an operating room and getting your ovaries cut out of you for no particular reason. So I kind of feel the same way about this. And I think it's a lack of thoroughness on the part of healthcare professionals in that they're all symptom driven. You present to that provider and you say, hey, I'm having heartburn all the time. And they're like, well, I got you. Here, this is magic from heaven. Just take this pill every day and you're good to go. No, ma'am, Pam. It's not that simple. It seems, feels, acts like pixie dust, but there's some complications. And now I've illuminated some of this for you. So if you're like, holy cow, Lucy, I've had heartburn for years. I've been on Prilosec for years, or I've been on Pepcid. So Pepcid, Tagamet, and of course Zantac, which is being pulled. But those are another classification of acid blocking medicines called H2 blockers. To me, they're a little less obnoxious than a proton pump inhibitor. So if I'm working with someone trying to get them off their Prilosec or Nexium, I'm going to put into place an elimination diet, just letting you know ahead of time. I'm going to meddle in your food. I'm putting into place that you're going to stop smoking because that aggravates that greatly. I'm going to put into place a gut healing regimen, and then we're going to talk about how to taper off the medicine smartly so that you don't have a nasty resurgence of the acid and you'll hate your life and you won't like me. And so we can use Pepcid, and then we can step down from Pepcid to perhaps Tums. And then I'll tell you the large majority of my patients, they don't need anything. We heal it, we fix it, we keep the acid down in the stomach where it belongs, we heal the esophagus, and we heal the root cause of why they were having the symptoms in the first place. I hope this opens your eyes that you need to be more aware when you're prescribed a prescription medication, that you ask perhaps more questions. What are potential adverse effects of these medicines? Because these providers know. They should know. Giving them the benefit of the doubt. They know, they're just not telling it to you. Maybe they feel like the benefit outweighs the risk, but I disagree with that because literally I've seen people on these medicines for 5 and 10 years. And so that's something that I'm aggressively addressing in my practice. And I will tell you, the gut is the seat of your immune system. And so the gut is everything to your long-term health, your longevity, and your vitality. So it is extremely important we don't disrupt the mechanism put into place there in the stomach, especially if you're making better choices and you're trying to make healthier decisions. We want you to reap all the benefit of that by having a healthy gut environment with the right balance of bacteria so that you can thrive. So in my next video, I'm going to talk in great detail about the very specific gut restoration protocol that I use and why I use this particular one and how we go about this and what are the benefits to you in this. So thank you so much for your time, and I will talk to you again soon.